So it's one thing to talk about the theory, but what's it actually like to wear an appliance, to live with one? And when I look back, just in reference to myself, about, I don't know, I guess about 20 years or so ago, I started to recognise the importance of this and the overlap with dentistry. Actually what happened was, I was working in a practice in a well-known street in London, which has basically got nothing but dental practice and medical practices and nothing else but. And somebody asked me if I would fit an appliance, and apparently what had happened was the dentist had gone rock climbing, mountain climbing actually, and wasn't there to fit the appliance, and I knew nothing about them, and I said okay, I'd be happy to do that. So it was an interesting experience for me, especially since I didn't know what I was doing, but nonetheless it just gave me the impetus, the push to find out a little bit more, and that was enough to make me realize, to see the connection. I'd been interested in jaw joint problems and jaw orthopedics, but I knew very little. Well, I knew very little about jaw orthopedics at the time, but I knew even less about sleep and sleep appliances and what dentists could do. So anyway, to cut a long story short, I fitted it. I didn't really know too much about it, and I found the patient the next day, see how they were doing, and they were over the moon. I didn't really understand exactly why, but they said that they slept very well. So fast forwards, I started looking into this and providing them. I'm learning how to do it, and of course it never crossed my mind that maybe, just maybe, I might be a candidate. I knew my father certainly had been a candidate. He died of a heart attack, and many years previously, and he snored, and he held his breath and had all the signs of obstructive sleep apnea, but unfortunately, of course, we didn't. As a family, we didn't, and as an individual, he didn't have the medical support to avoid what happened. Anyway, cut a long story short, once again, moving forwards, it actually occurred that I was in I was working in Boston, and I was at the time doing a course which was with about 6 other people, and they were all in their late 20s, late 20s, and of course I was not. And so they found it terribly amusing, and they were kind of chatting amongst themselves, and I said, so what's so funny? And they said, well, we're just watching you at about 7:30, 8 o'clock. Well, fair's fair. I mean, it's 11 hours, of study. And they said, because you're just kind of going and just nodding off. And I said, I didn't notice that. And they said, well, you are. So I thought maybe it could have something to do with obstructive sleep apnea. So I got tested while I was in the department, and big surprise, I had moderate, I can't remember exactly what it was now, but it was mild to moderate, but into the moderate level of obstructive sleep apnea. I did snore, and I knew I snored, and my wife knew I snored also, and so I had an appliance made. Well, I made the appliance, and I didn't do the laboratory work. I just did the workup, and then we had the laboratory make the appliance, and then I realised, I would just want to tell you one other thing too. It's a very personal thing, but I had a very pronounced gag reflex. I couldn't put things in my mouth. Even sometimes it was very difficult for me to brush the backs of my teeth, especially on the inside. And having impressions was less than fun for all concerned. And I now realise, well, let me go back. And so that was a big concern, because I thought to myself, well, even if I can get even if I get the impressions for the appliance, of course, being typical dentist, I do it all myself. And even if I can do all of those things, am I going to wear something? Am I going to be able to wear something in my mouth? And I doubted it, to be quite honest with you. They were relatively bulky at the time, but didn't think I had much choice really, and I was a bit reluctant to do anything, but I knew I had to do something. And incidentally, truthfully, I hadn't tried CPAP because it was a dental department and that's what we were doing. So CPAP didn't come into it as an option until later on. So I had the appliance back, fitted it and adjusted it, felt very comfortable, and I was ready to have to go through several weeks of acclimatization. And when I put it in the evening, it didn't bother me as much as I thought it was. The more I thought about it, the more it bothered me. But nonetheless, it wasn't really a big issue. And I went to sleep, and I got up in the morning, and truthfully, I was quite shocked. I couldn't see how I could have slept with that in my mouth, but I did. And my sleep was dramatically improved. My wife wasn't actually there at the time, but later on, when she was back in Boston again, she confirmed that I wasn't snoring. So it was all round a big success. Now that was quite a while ago, and subsequently I've had different appliances, because as a dentist, it makes sense to try the different things out so that you can tell people what your own experience has been. So I did actually try CPAP, which is this is what I get round to. I did try CPAP, and I've said this to people, and I maintain this. If I had to wear CPAP, I would duct tape it to my face if it saved my life. I didn't enjoy it. I found it very frustrating, and anybody who's watching this that sells CPAP, I'm sorry. I'm very fortunate because the oral appliance works and I don't have to wear CPAP, but I want to stress that if I had to, even if it meant duct taping it to my face, I would. I think this is sufficiently important that it crosses political barriers here, and I don't really care what people do, but that's speaking as a dentist. Providing there is effective, can't stop being a dentist anyway. But suffice it to say, I don't think it really matters, providing you're being effectively treated with something that you can manage well, right? So back to me as a patient rather than a dentist. So I had a number of different appliances made, and the most recent was the milled plastic one, and milled nylon one, which is quite flexible and it's really very comfortable to wear. So I thought, well, I'll do a little testimony of this, and speaking as a patient now, it's kind of hard because I'm a dentist, but speaking just as a patient, primarily as a patient, this is magic. It really is magic. I'm sure there are some people that can't wear this, well, not this particular one, you can't wear that because of mine. I'm sure that there are some people that can't wear oral appliances, and I'm sure that there are some people who, even if they could, would prefer to wear CPAP. And I know there are people that really should be wearing CPAP because their obstructive sleep apnea is so severe that it's the best approach. Having said that, if I had the choice, I'm sorry, it's a no-brainer. An oral appliance, for me, is the way to go. I get up in the morning, I take it out of my mouth, I brush it carefully, I put it back in the little case, and I go about my business, and I have slept through the night. I then do my stuff, get ready to go to bed, and brush my teeth, floss my teeth. I'd give this kind of like once over, even though it's just been sitting there, and usually it doesn't really matter, but I just make it wet and stuff, and then put it in, and then that's fine. I mean, to me it's a bit like putting a pair of slippers on. I mean, it just feels right. I genuinely couldn't go to bed without one, this one, simply because, okay, there may be a psychological aspect to this too, I don't know, but there's certainly a physiologic one. When I go to bed, I am fully aware. I mean, sometimes I'm lazy too, and sometimes I go to bed and I don't really, and if I've forgotten it, which is extremely rare, I don't really want to get up because I can't be bothered. So I do lay there for a couple of minutes, and until I realise that I might as well get up and do it, because I'm not going to sleep without it. So I did actually forget it once. Went to the office, and someone had suggested that I be photographed, sort of, you know, sort of a bit salesy, but with the appliance. So more for me, I went and I took it and I left it at the office. And it was about, I didn't have any keys for the office at the time, so I had to go without it. And that was the worst night I can remember. That was my worst night's sleep that I can remember. I felt it jolted me awake when I knew that I was stopping breathing. I could hear myself snoring. But what was worse was that I woke up in the middle of the night in a cold sweat, which is a typical finding. It's basically a sympathetic nervous system response, and it was just awful. And I thought to myself at the time, if ever I was in any doubt about whether I should be wearing my appliance, I'm not now. So the testimony bit is this. If you have obstructive sleep apnea, it's only going to get worse, so you might as well kind of get with it, because you either don't treat yourself and you take the consequences, which my dad did, but it wasn't his choice because he didn't know any better. Or you can choose to have some kind of treatment. If you choose to have some kind of treatment, there are several, as I or your dentist, if you're not my dentist, if you're not my patient, will tell you. An oral appliance is great because, for me, because it's non-invasive. I mean, if I wanted to take it out, I could take it out, but why would I? So anyway, the bottom line is, as a testimony, I think they're great. It requires some knowledge, skill and experience to make an appliance effectively, but it does for everything, right? I mean, you know, whatever you do, it requires a little bit of effort to find out how to do it, and then as time goes on you build the skill and experience. So if there's a dentist watching this, take heart and get in touch. The benefits to me and to people, fellow sufferers, is one thing. The benefit to our patients is something else. I mean, if you just want something to build a practice, that's good enough. I mean, it's just such a wonderful service. But the whole purpose of the exercise here was to tell you about my experience, and I don't know what the future may bring, but at this point in time, an oral appliance is great. Oh, one other thing too, it's really easy to take anywhere. I mean, with COVID, none of us are going anywhere, but you know, in times when I go on courses and things, this always comes with me in cabin baggage. There's no way I'm risking this in checked, you know, in the stuff that goes underneath. But I think it's checked in baggage, luggage. So it always goes with me in the cabin. But the thing is, it's so easy. I actually did have one security guard ask me what it was, and when I told him, He was quite interested and wanted to know if his dentist did them. So it was in Calgary. And so I told him to go and ask him. So if you have any questions, ask your dentist. If I happen to be your dentist, then I'm very fortunate and you can ask me. But from my perspective as a dentist, it's a fantastic service. From my perspective as a patient, it's an absolute lifesaver. It's a godsend. So that's my bit. Thank you.